Assalamu alaikum. My name is Dr. Adil Rahat and I am working as a senior registrar at the Department of Gastroenterology, Liaquat National Hospital, Karachi. And I am here at the platform of Pakistan Society of Hepatology, the 22nd Annual Congress. And the title of the abstract that I'm going to present today is High Seroprevalence of Hepatitis E virus among healthy asymptomatic blood donors in Pakistan. Can the risk of transfusion-dependent transmission be ignored? Let me introduce my co-authors. First is Professor Dr. Lubna Kamani, who is also my mentor, and she is working as the program director and consultant at the Gastroenterology Department of Liaquat National Hospital, Karachi, and also at Aga Khan University Hospital. And then there is Associate Professor Dr. Sana Anwar, who is working at the Microbiology Department of Liaquat National Hospital. As we all know that hepatitis E virus is a major health burden globally and it is endemic in Pakistan. Pregnant women and especially immunocompromised individuals are at high risk of developing acute liver failure or chronic hepatitis secondary to hepatitis E virus. And as far as the routine screening of blood donors is considered, HEV screening has not yet been implemented in Pakistan or other endemic South Asian countries. And there is also a dearth of literature regarding the seroprevalence and viremia of HEV among healthy blood donors, especially in our country. So the main aim of the study was to assess the seroprevalence and viremia of hepatitis E virus among healthy blood donors in a tertiary care setup in Pakistan. We did a cross-sectional study that was conducted at the Liaquat National Hospital. Blood samples were obtained by the voluntary blood donors after taking a written informed consent, and they were subjected to the routine testing along with ALT monitoring and HEV antibodies testing both for IgM and IgG. So a total of 515 individuals were enrolled in this study, all of which were male. Age ranged from 18 years to 54 years. None of them had any prior history of alcohol intake or viral hepatitis, autoimmune disease, or any medical or drug history. The mean ALT levels were recorded at 42.8447. Anti-HEV IgG was found positive in 365 individuals, which makes up approximately 71% of the entire sample size. Mean ALT levels for IgG positive individuals was 43.61 and IgG negative individuals was 41.98. The cutoff limit was 41 at our lab. HEV IgM was found positive in 31 individuals, which makes up 6% of the sample size, and negative in 484 individuals. Mean ALT values for IgM positive patients was 44.06, and those who were with IgM negative, they had a mean ALT level of 42.96. All those who were tested positive for anti-HEV IgM were subjected to PCR testing, which came out negative. The upper limit, the detection limit of PCR was 20 copies per ml. So here's a look at the analysis depending on the basis of anti-HEV IgM and anti-HEV IgG. There was not a major difference among the two, although the ALT levels were found slightly higher in anti-HEV IgM positive patients as compared to those with anti-HEV IgG positive patients. Here you can see the second table as well. So it was not significant. On your left, you can see a pie chart which shows that 6% of the individuals were tested positive for anti-HEV IgM, which was more than the combined percentage of patients who tested positive for HBV and HCV. So this is a serious number, and on your right, as you can see, that out of the 515 individuals, 31 tested positive for anti-HEV IgM, 11 tested positive for hepatitis B virus, that is HBV surface antigen, and 9 patients tested positive for anti-HCV antibody. We also tried to analyze the level of ALT among various individuals. The cutoff limit for male at our lab was more than 41, which was found in 195 individuals out of 515. And all those individuals who had a collective BMI of more than 29.2. So out of these who had an ALT levels of more than 41, 141 were positive for anti-HEV IgG, and 7 were positive for anti-HEV IgM. So the limitation of our study was that the kit that we use for testing the RNA PCR for HEV had a cut limit of 20 copies per ml. But from our study, we can conclude that there is a high seroprevalence of anti-HEV IgM among healthy blood donors, and it emphasizes the need for robust measures of routine screening for HEV of all blood products in an endemic country to prevent transfusion-dependent transmission, with special consideration when the recipients are either immunocompromised or pregnant females. Thank you.